The numbers of active COVID-19 cases in Nigeria have all of a sudden been spiking after a short period when it seemed that the worst was over. Infections have certainly been on the rise, but the same may not be exactly true about testing and hospitalizations. And from the look of things, Nigerians, at least a majority of them, may have given up on the basic safety protocols as laid out and consistently emphasized by the Nigeria Center for Disease Control. But will it be correct to blame this sudden resurgence only on the decline in the numbers of mask-wearing Nigerians? What about the opening up of the economy by the Nigerian government at the peak of the initial wave of the crisis? Are schools and religious organizations being adequately monitored to ensure total compliance with these safety protocols? Well, for a comprehensive appraisal of where Nigeria is with the management of the COVID-19 pandemic, we will now be joined by Dr. CHIKE IHEAKWUAZU, Director General, Nigeria Center for Disease Control. Dr. IHEAKWUAZU, it's good to have you again on the morning show. Thank you very much for joining us.
Thank you. Good morning, Ruben, to noon, Rufai. Great to be on your show.
Morning, Doctor.
Thank you. Morning, Doctor. Well, Dr. IHEAKWUAZU, where are we at the moment in terms of how Nigeria is managing the COVID-19 pandemic, particularly with regard to these latest developments, countries making down payments for vaccine? Are we part of that race, or it doesn't concern us?
Thank you very much, Ruben. Good morning to your viewers. I think let's start with where we are, because, you know, your introduction said that we were having a spike in cases. I don't think that's, there is some truth to that, but it's not completely accurate. You know, over the past 2 months, we report between 100 to 200 cases a day. There are small increases, small decreases, but we really haven't seen a spike in our national data. There's been a recent increase in a few cases in Lagos, and we're monitoring that very closely. They're mostly among younger people, younger populations. So that's where we are. We have worked very hard. If you look at our testing numbers, yes, they haven't gone up as high as we would have loved to, but apart from a small decrease during the peak of the demonstrations a few weeks ago, we have managed to maintain our testing numbers at, you know, about 30,000 tests per week. So generally, I would still say, listen, we need to be cautious and continue, but we haven't seen a spike in cases in Nigeria. Now, to your question around vaccines, this is obviously the most topical issue for today. And to be honest, it gives us the first significant ray of hope in a 10-month response. For the first time, even if the vaccines are not here, at least we can, all the healthcare workers have been working so hard, you know, our leaders, we can offer them a ray of hope into the future that, listen, something is on the horizons. So we have announcements of 2 new vaccines. They're based on very similar technologies that have never been used before for vaccine development. So very exciting news among the scientific community in terms of what is possible. In terms of access to the vaccines, our primary accessibility pathway is through a coalition brought together by the World Health Organization called COVAX, through which we have been assured of vaccines to cover 20% of the population. So we're working very hard with partners. In fact, we have a meeting today in that regard to, you know, plan the logistics, the enlightenment. You know, it's not the vaccine itself that will save any life. It's when that vaccine gets into a human being. And so many processes still have to happen for us to get the vaccination to happen versus the vaccines. So that's what we're working on at the moment. That's led on by a sister agency called the National Primary Healthcare Development Agency. And we're working very hard collectively across government to make sure that we are prepared to distribute these vaccines efficiently across Nigeria and make sure that Nigerians really fully understand the value of vaccines and the potential that it brings to our returning to a way of life that we're more used to.
Thank you for that. Like you said, you're working on both ends, the distribution, sort of logistics end, and also preparing Nigerians to actually take the vaccine. What do you think of the climate here of vaccine hesitancy? How much of an uphill task will it be to get Nigerians to roll up their sleeves? Because you must be aware of various conspiracy theories and outright lies being peddled about vaccines.
Yes, thanks, Tunu. That's a very important question. And vaccine hesitancy is really something we've struggled with across the world. In Nigeria, we do have our own history, but we managed to overcome that. I want to be unambiguous in my answer. Vaccines are the greatest medical invention ever so far. Beyond antibiotics, beyond surgery, it has saved more people than any medical intervention in history. The challenge with vaccines is that the bar is a little bit higher, because with medicines and therapeutics and surgeries, they're administered to people that are ill. So you have to already be ill for you to take an antibiotic or for you to go for surgery. Vaccines, the bar is higher because we're giving them to people that are well, entire populations of well people, in order to prevent a disease. So we have to work a lot harder on safety. And that's really why, as the scientists have worked on these vaccines, and there are quite a number that may be announced before the end of the year and some early next year, there have been two important features of a vaccine that we have been waiting for. Of course, everyone is talking about 90% effectiveness, efficacy for the Pfizer vaccine and 95% for the Moderna one. But the critical other factor that has been reported, but no one is is not the focus of attention, is the safety profiles. So the safety profiles of both vaccines, considering that the new technologies are very high, very few events have happened in the use of these vaccines that would cause for alarm. But so we're very excited about that. But the caveat to that is sometimes it's difficult to fully assess safety in a short period of time. So you need to have given a good number of people the vaccine over a fair number, over months, sometimes years. So we will keep learning and keep watching for signals. And it's why that as we roll out this vaccine, we also roll out a surveillance system in parallel to pick up any events that might be cause for alarm. But right now, I think the data coming out of the vaccine trials is much better than any of us had dared hope for in the scientific community. We were estimating that, listen, if we have a vaccine of 60, 70% efficacy, we would be, happy with it. And nobody dared to hope that we would come up with 90, 95%. So I think really the world's challenge right now is to get away from the competitive mode that Ruben spoke about and really work towards a collaborative mode. The vaccines that we use in our childhood immunization programs, you never hear that companies or countries are struggling to buy. We've organized ourselves as a global community over many, many years in terms of vaccine procurement, distribution to the last mile. But suddenly, the global climate is such that there's not a lot of collective global leadership at the moment. So many countries have gone on their own paths, especially the richer ones. But many of us in the low middle income category have come together in this collaboration to consortium, to work with WHO to say, listen, there's an alternative way to do this, probably a more efficient, effective, and better way, by pooling our resources, pooling our knowledge, and using that as a collective bargaining tool with the vaccine companies to procure vaccines for our population. So that's really where we are, and we are hoping that we can really drive forward distribution and fighting the hesitancy that you mentioned in Nigeria.
Right, Doctor, I can see the glee on your face. You're just talking about the vaccine and a little sense of triumphalism, as it were. And that's quite exciting for the world today, because all what we have gone through as a result of COVID. But I really want to ask two questions. I want to know the results of those prevalence tests that we talked about the last time you were here. And I want to know how many tests you're carrying out per day now. How much are we testing per day now, and the results of the prevalent tests?
So great. Let me start with the second question. It's easier to move into the other. We test about 3,000 to 5,000 people per day. And our target was to test 1% of the Nigerian population if you look at Nigeria as a country, we haven't reached that. We're about 40% of that. But if you look at specific states, then we are well above that. So in Lagos, we have surpassed that. In FCT, we have surpassed that. We're about to reach in Rivers, Plateau, and Gombe. So there are certain states that are doing very well. But our collective average pulls us down because many states are not pulling their weight and not trying as hard as we would like them to. So we keep working with the states. We have a subgroup with NEC, the National Economic Council. I think we're actually meeting tomorrow to discuss progress in the various states. Because of our federal nature of government, we can't drive everything ourselves from the federal government. So we have to keep working with states to activate their mechanisms to keep testing. And you will notice that the states where we've reached our target population and even surpassed it are states that have had the highest number of cases. So there's also a mental thing there, in states where people see that others are getting ill from this virus. It's more likely for you to be convinced to go and test because you most likely have seen or someone that's had the disease. In states where cases have been rare, thankfully so, it's less likely that people test. So there's a lot, when you talk about national averages in Nigeria, it's always the devil is in the detail because some states are doing very well, and others are not. And sometimes the average is lower than we would expect. On the second question, or on your first question, on the prevalence survey. So progress is excellent. We've finished sample collection. One thing keeps amazing me in Nigeria, when you do a survey, your acceptance rate among the population is very high. So people are willing to give information to allow their sample to be collected. So I'm very grateful for Nigerians that have just been approached across the country to offer samples for this survey. So we've completed sample collection, and we've started doing the analysis and quality assurance, and we're hoping that by the end of this month, early December, we'll be able to have figures for the country. We're extending, we started with 4 states, we're extending it to 2 more states to have at least 1 state in each of the 6 geopolitical zones in Nigeria. So I'm really proud of the progress we've made, and we'll be able to offer Nigerians some more information at the end of the year. So, but, the real challenge around testing, not to get too carried away in the work being done, is where I want to be open. We're by nowhere means where we want to be. And, it's been a 10-month response, so sometimes it is difficult to keep people motivated, to keep them saying and doing the same things and going out. But, we want to keep trying collectively and keep that collective momentum going over the next few months, even with the hopes in the horizon of a tool that might make our lives a little bit easier again.
Dr. IHEAKWUAZU, will it be correct to say that the biggest challenge we face in Nigeria at the moment is COVID fatigue at the official level and also perhaps among the people? And that's why, you had to qualify the initial statement that there has been a spike. Are we really doing enough testing? Many Nigerians will say no. And then if you look at the Nigerian society, everything has been opened up. Parties every weekend, people going about their normal businesses. Nobody seems to care about this pandemic any longer. Whereas in other parts of the world, you will see, lockdowns, what they call lockdown 2.0, being imposed on the people. Does the lackadaisical attitude that is so prevalent around there, does it bother you as somebody who is in charge of disease control in the country?
Yeah, Ruben, there's nothing that keeps me awake more at night, than when I see images of large gatherings, especially in indoor settings. Indoors are the riskiest settings, especially, where the ventilation is poor. I do agree there's a lot of COVID fatigue. I understand some of this. It's been a long journey, and, we keep saying the same things over and over again, but there's no other way at the moment. And really, we have had a fairly successful response so far in the reopening of certain parts of their economy without seeing the spikes that were predicted, or we reopened the aviation industry very carefully and deliberately. The schools, We haven't gotten to universities yet. They are a specific risk environment because of a combination of mobility of young people and their age groups. Now we are in the middle of opening youth service camps in the country. That has been an incredibly extensive logistic exercise. So, we are by no means out of the woods. And, there have been spikes in other countries. In fact, huge increases. But we also have to understand that in certain parts of the world, India is seeing a reduction in cases. Australia is seeing a reduction in cases. So we mustn't all be focused on the countries with the TV channels that we watch the most. In other parts of the world, there are seeing decreases in incidents. But because most of our travel is to countries where there is an increase in incidents right now, in Europe and the US, we have to kind of really watch that aviation industry and the entry of Nigerians, especially as we go into the festive season. So our message to Nigerians is, listen, please don't travel if you don't absolutely need to. If you want to come back for your usual Christmas holiday or you want to travel, this year is probably a year where you can say, let me forego that for this year. Unless it's absolutely essential, we are completely discouraging travel. But if you do have to travel, then you will have to go through a few inconveniences. You will have to do the test before coming back. We will check you on arrival. You do a subsequent test. We'll expect you to stay at home for 7 days on arrival. So these are inconveniences that we absolutely need to accept as the price we will have to pay if we do have to travel. So the best advice to everyone as we go into the Christmas season, please, if it's not absolutely essential, let's stay at home and enjoy Christmas with our families.
Thank you for that reminder. It's really not worth it. I don't think so anyway. Now, doctors in Kenya have given their government a 21-day ultimatum to address certain lapses and provide PPE as a result of the deaths of 10 medics in Kenya. So what's the morale like in Nigeria for those fighting this disease on the front lines?
Yeah, so thanks, Tundun. Kenya is going through a bit of a difficult patch. We've seen an increase in cases recently, and deaths in healthcare workers is always very painful. It's almost like deaths in your in the military when you're fighting a war, because they are on the front line and supposed to be protecting you. So when you see some of them fall, it's not just them, it's what it means to the entire response. But we must learn from that. There are many things we may not have done perfectly in Nigeria. But, one story that will be told at some point is, we have maintained a supply chain across the country of personal protective equipment to doctors, nurses, healthcare workers working in secondary and tertiary facilities in all the states in Nigeria. So every month we send out truckloads of PPEs to every state, supply the teaching hospitals, the federal medical centers, and the states. This is in addition to what the states are procuring themselves, what the private sector is procuring. So there's been an incredible effort to get PPEs distributed in Nigeria. We had the first kind of bottleneck when the whole global economy was shut down and there wasn't a lot of access. But since we solved that and transportation means reopened, we've sustained the supply chain across the country. And we'll keep working very hard at this. The challenge really is the size of the country and to get it not beyond the secondary and tertiary facilities down to primary healthcare centers where most of Nigerians would go for their immediate care. So this is an incredibly complex process. However, I think the good news out of this is there have been a few new businesses, entrepreneurs, that have set up companies to produce PPEs locally, masks, the gowns. And, I'm really excited about that because this is one area that I hope is not just an outbreak response. We really want the use of personal protective equipment in appropriate use, so not all the time, but to know when to use it, to be completely transformed in how we deliver care. And we think that should be one of the legacies of this outbreak, so that healthcare workers are protected as they deliver care to all of us, that we all whether we're doctors or not, we are all also patients, and we want our healthcare providers to feel safe and confident as they provide care for us. So a lot of lessons to learn out of Kenya for us to prevent that type of situation from happening here.
Right. So a lot of questions coming in. I want to know about your response to the NYSC camp, some cases, talked about. Also the cases in the schools in Lagos. I think over 100 cases in a particular school and another school in Lagos. What's your reaction to that? And somebody's also asking here, have those vaccines been ordered? That's another important part to it. Just those three questions.
Thanks, Rufai. Let's take the one on schools first. I think the detection of cases in schools is really credit to the great work being done in Lagos and our surveillance systems at the state level. We found a single case in a school in Lagos. Together with the team in Lagos State, screened a much larger group of students and found quite a number of other positives. You've mentioned a number, it changes every day. But most of them are asymptomatic, because of their age. These are people that would not have been detected without the response. So the response led to us finding more cases, and that's exactly what we want public health to be doing. We want an alert to happen appropriately, the appropriate response, and then to identify cases and then to take appropriate measures. And that's really what has happened in the two schools in Lagos. And none of them have been critically ill, so primarily because of the age group affected. So, yes, we've had a few cases, and we will expect school transmissions to happen. But remember, the biggest risk among cases in young people is their access and contact to older people. So most young people rarely have a serious clinical illness, but we want to keep them away from the elderly because those are the ones most at risk of having a severe illness and risk of death. So we'll keep working with Lagos and other states to investigate school outbreaks. The second question on NYSC camps, I saw a bit of reporting around cases in NYSC camps. It's important to clarify this. There have been no cases inside NYSC camps. To reopen camps, we started working with NYSC. We prepared for months for this. We are screening every single young person coming back to a youth service camp. So for this first stream, there are over 45,000 people, both corpers and members of the NYSC camp community. So before you get into camp, you are screened. It's through that screening process, naturally, that we have picked up a few cases across the country of people coming back to this camp, not knowing that they're ill, infected themselves, being tested, identified, and then excluded from the camp, appropriately isolated, and then managed. So this is really what has happened. This was the reports that went out yesterday, and there was some miscommunication in how it was reported. But there are no cases in the camps. The cases we have detected are because of the measures that we took beforehand to prevent people with infection getting into the camps. So that's actually a good thing. So we'll keep... Sorry?
Have the vaccines been ordered?
Your final question on the vaccines. Yes, like I said, we're working with the COVAX facility through which we have a guarantee to cover 20% of the Nigerian population initially. And we will have to prioritize who those people are, mostly healthcare workers, and then potentially we'll do some age classification because of the elderly that are most at risk. But that's kind of the work that's ongoing right now. But this is a fast-moving area, and as more vaccines become available, we will definitely work towards increasing the 20% to more. But that 20% is the initial part. I'm really hoping that by the end of the next year, with both supply increasing and obviously us working on demand, we can work towards covering as many people as we would, as we can in the Nigerian population with the vaccines that become available.
Well, thank you very much, Dr. IHEAKWUAZU, for joining us this morning on The Morning Show. Thank you very much indeed.